Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA Finley.
Dr. Gashti, G-A-S-H-T-I. Dr. Gashti is a vascular surgeon, and we're certainly happy that he took the time this morning to talk to us. Good morning, Dr. Gashti.
Good morning.
Thank you for being with us. And I see, of course, that your specialty is you're a vascular surgeon. So what does a vascular surgeon do?
Well, we deal with diseases of the vessels, arteries, and veins. That includes aneurysms, blockages in the arteries, issues with veins, dialysis access, and so forth.
And so that's something that not everyone has a problem with. How does one know that they should be seeing you, a vascular surgeon?
Well, it depends, what kind of issue they have. If it is an individual who is scheduled to undergo dialysis, obviously their doctors, their medical doctors, or their nephrologists would refer them to us for access for dialysis. If you have an aneurysm, that may be discovered by physical exam or on some sort of imaging study like a CAT scan. But most of the time, the patients that we get are patients with peripheral vascular disease, which generally means you have some blockages in the arteries of your legs. And then when you start walking, you get cramps or pains in your calves or thighs or buttock, depending on the location of the blockage. And that's when they come to see us to see if this is vascular or is there other causes of their discomfort. So it all really depends on the territory of the problem.
So we have different kinds of situations. I see this. Some are more serious than others. So let's say if I have a few little veins on my leg, and what do we call those?
Well, they can be varicose veins.
Yeah,
they
varicose,
can be spider
right.
veins.
Spider veins, that's what I was thinking. So spider veins, first of all, I have a few questions. How do they happen, and are they dangerous?
Generally speaking, spider veins are not dangerous. They are sort of a cosmetic issue, but the underlying problem is a more important issue. So these are veins. These are not arteries. So arteries carry blood away from the heart. Veins carry blood back to the heart. And veins in our legs, they really have to work hard all day long because they have to push the blood up towards the heart, and they're fighting gravity all day long. So veins have valves in them. So as the blood moves up your legs, these valves are supposed to close. These are one-way valves. And if these valves are not working properly over many, many years, that vein blood constantly goes down towards the legs because that's what gravity is doing. And for the veins to allow for that excess blood, they just need to get bigger and bigger. That's what varicose veins are. And the spider veins, or what are called telangiectasias, those are the beginning of this process. So is a condition called venous insufficiency, and that unfortunately is very common, and unfortunately is very much underdiagnosed.
Yeah, that's very interesting. You should say that because I have rarely heard of people who say, I'm having my veins taken care of, unless it's serious, So are you saying, though, and do you do this in your office? If I had not varicose veins, but spider veins, would you do something about that, and what would you do?
Yes. So first thing is I don't think you watch TV too much because there are commercials on TV all the time about vein centers and so forth. No, we actually have a large client with venous insufficiency. We treat this in our office. The treatment modalities are several. We can, again, depending on what the underlying issue is. If you have reflux, we do what we call venous ablation. We close those veins. The smaller veins, like the spider veins, we can do what's called sclerotherapy. We inject them. We can do what is called phlebectomy. The larger veins we can actually physically remove. So depending on, your physical exam and the issues you present with, the treatment modalities are several that are available to us. And most of these we do in our office, actually.
So if one has high blood pressure, does that have any effect on this?
No. High blood pressure goes back to an arterial issue. And like I said, this is the venous insufficiency situation is about 95% hereditary. So people who have varicose veins or these spider veins, when you ask them, their mom, their aunts, their sisters, there are family members with this condition. So this is a hereditary condition that is not related to arterial high blood pressure. But when you have venous insufficiency, you develop venous hypertension. So the pressure in your veins actually goes up. And that's why when people walk around, that their legs, they complain of heaviness in their leg, because all that blood sort of is pooling in their legs, and they have to drag the legs because that blood is just not getting out of the leg. So you develop venous hypertension, but that's different than the hypertension that the general population sort of is familiar with.
Well, this is a very interesting conversation. I don't think that I've had very many of these, and I speak to many doctors over the many years I've been doing this. I'm a gerontologist, and so the older adults are very important to me, and I gather that it sounds like, is this more of a female problem than a male?
That's absolutely correct. I think there's been some thoughts about the hormonal effect on these valves in the veins. So the effects of estrogen makes it a bit more common in female than male. But it may just be that, female patients are a little bit more concerned about, the way their legs look and so forth. Maybe they present more. But we definitely see a lot more female patients with venous insufficiency than male.
Well, that's too bad. But so the men have their problems also. But I want to move along with this with exercise. What would help having less problems with veins? Would you want to do more exercise?
Yes. So unfortunately, we do not have a cure for venous insufficiency. So we have to treat the symptoms. The main treatment modalities are elevation and compression. So again, for the reasons I explained earlier, anytime you have this condition, anytime you have 5 minutes break, or you can sit down and, if you want to watch TV, you need to elevate your leg. And once you elevate your leg, you use gravity to your advantage. So you drain those veins out of your legs, and the blood goes where it belongs to. And then you wear compression stockings. These are graduated stockings, so they have high pressure by your ankles and toes, and then gradually it decreases so that it kind of squeezes that blood out of your legs. But exercise is also very important because as we walk and the muscles expand and contract, that's the pumping action to push that vein blood up or to where it belongs, back to the heart. So exercise is very important, but you got to make sure that you have your stockings on. Make sure that after you're done, you go sit someplace and you put your legs up to make things better.
This is wonderful. Thank you. My guest is it Dr. SAYED-MOJTABA GASHTI? Did I say that right?
That's perfect.
Oh, good. So Dr. Gashti is affiliated with the West Boca Medical Center, right? Medical Center. But he has his own, you have your own practice. Can I have a phone number that if people want to go see you, they could call you there?
Sure. Our phone number is 561-483-3989. And we have two offices. One is in Deerfield Beach, and the other one is in Boca Raton, just outside West Boca Medical Center.
Okay, that's excellent. And so anyone now who thinking about their legs or understanding what Dr. Gashti has just told us, this is a very important appointment to make. I think that most of us, unless we have something very serious where it's gone too long, don't know about this. So just as you go and you have dental examinations and go to the podiatrist for your feet, why don't you go and make an appointment with Dr. Gashti and have him review your venous problems, right? Your venous problems.
Correct. And you know, there are, of course, there are a whole variety of arterial problems as well. So there are certain risk factors. You know, you may not be symptomatic right now from an aneurysm, for example, but we know there are certain risk factors that increase your risk of having an aneurysm. And an aneurysm is a silent killer because most of the time we don't really find out about it until a patient presents to the emergency room with a ruptured aneurysm, or actually I had one last night at West Boca.
Oh, really?
1 a.m.
Tell us about that. What actually is that? What happens?
So an aneurysm is, so this particular one, it was in the abdominal part of the aorta. So any place you have an artery, and arteries are just like pipes. So when a segment of that artery starts dilating, sort of ballooning out, that's what's called an aneurysm. And the problem with an aneurysm is that eventually, just like a balloon, if you keep blowing into it, it eventually is going to burst. Aneurysms do the same thing. And if it gets large enough, it bursts. And again, this is a big pipe. And unfortunately, about 80% of people don't even make it to a hospital when this happens. They die. And of those who make it, a bunch of them don't even make it out of the hospital. So it's a very serious condition. And the problem is that the aorta is all the way next to your spine, is to the left of your spine. So on routine physical examination, it is very difficult to actually palpate it, to touch it. Especially nowadays, the obesity epidemic is very high, so it's hard to feel your belly and feel the aneurysm. So a lot of times these are found incidentally. You go in for a CAT scan for some other reason, or for a chest X-ray or an abdominal X-ray, and lo and behold, there is an aneurysm. But most people don't know about it, and unfortunately, like I said, they present only when it is symptomatic or ruptured or is leaking or getting ready to rupture. So there are certain risk factors that we look for, and if you have these risk factors, then we can get an ultrasound to see if you have an aneurysm, to get an ultrasound of the carotid arteries to make sure you don't have significant blockages in the arteries of your neck, which can then cause a stroke. I mean, that's another silent disease because most people present to the emergency room with a stroke, and that's only time we find out, oh, you have significant blockages in your neck arteries. So, yeah, I mean, vascular evaluation for those individuals who have these risk factors, and I can just go quickly over the risk factors.
Please do that. Yes, please do that for us.
Smoking is the number one, very important. If you smoke, stop smoking today because it will just do you quite a lot of harm. As far as your vessels are concerned. Diabetes, high blood pressure, high cholesterol, and a family history of vascular disease. So if your dad had an aneurysm and you are his son, you are at very high risk of having an aneurysm yourself. So you need to go get an ultrasound of your belly. Make sure that you don't miss that. So once we see these risk factors, then we can start, getting some of these studies, which are usually ultrasounds. They're very non-invasive, they're cheap, they're not painful, and then it can save somebody's life.
Wow, that's terrific. I have so many questions to ask you, and we only have another 10 minutes, but it's wonderful having you on our show, Dr. Gashti, and I want to give you his phone number again, because you can make an appointment. His number is 561-483-3989. Remember, this is Pencil Talk Radio, so get your pencils out and put this in a notebook somewhere, so not on a little yellow sticky because you're going to lose it. But this is a wonderful thing, so once you really think about it, look at your legs, think about what Dr. Gashti said. Ultrasounds are very easy. I've had many of them. It's 561-483-3989, and he has offices both in Deerfield and Boca Raton. So, Dr. Gashti, just going back over this, what you said, though, about putting your legs up, but when you do that, do your feet get numb when there's no blood in them?
Well, it shouldn't, because, again, we're not talking about the arteries. The arteries, typically patients who have venous insufficiency are younger, and arterial disease is a disease of elderly most of the time. Mm-hmm. So when you elevate your legs, it actually should feel better. Now, if you happen to have a component of arterial disease as well, if you don't have pulses in your feet, then it may make your feet feel numb, or actually your toes may even hurt. That's called ischemic rest pain, but that usually happens to individuals who have really severe arterial disease. But a purely venous condition should not cause numbness of your feet or toes when you elevate them. You actually should make them feel better once the swelling goes away.
So if someone goes in and they you treat them, as you said, you treat them for the spider veins, that's pretty simple. They don't have to have bandages on that. And I gather also with even the varicose veins, unless it's very deep. Is that a pretty simple procedure?
They are all simple procedures, but they are procedures. There are obviously certain risks and complications, but they're safe enough that most of us perform them in our offices, and patients come in, have it done, they walk out of the office with a Band-Aid on their leg. But you always have to realize that anytime we do a procedure, there are certain risks, and that is why we make sure that there is an indication to do these procedures, so that the benefits of having the procedure outweigh the few minor risks that come with it.
It's great talking with you. As I said, I've had so many physicians on my show with many, many different specialties, but maybe only once or twice over the years have I had someone that has done such an excellent job of explaining all this to us. And I want to go back to the compression stockings. So I was told that even if you don't have problems, if you're flying on airplanes and going long distances, you should put compression stockings on. Why is that?
Well, I think most people do experience some degree of swelling in their legs when they're up at 35,000 feet. And if you're going, on an 8, 10, 14-hour flight, and you're not moving around, is not only that your legs can swell up, but you can also form blood clots in your veins. One of the major risk factors for forming what are called deep vein thrombosis, DVT, is immobility. And that's why, when you see patients in the hospital, they all have these devices on their legs that are massaging their legs, pushing blood up and down to prevent blood clots from forming. So if you're sitting in one of these very uncomfortable seats in a plane and you're going, transatlantic, and you're in a plane for several hours, you can be at risk of forming a blood clot. So compression stockings also help with that. And also I would always recommend to my patients who have, particularly those patients who have venous insufficiency, that if you're going on a long flight, make sure you have your stocking, and make sure as soon as they allow you to get up and walk up and down the aisle to get that blood moving. Remember that pumping action of the muscles, but you have to use those muscles to have that pump. So you need to get up and walk back and forth when they allow you to decrease your risk of having a, God forbid, a blood clot that then can break off and go to your lungs, and that's a major emergency, and you don't want that to happen at 35,000 feet.
Right. Now, I have a sit-stand desk at home. Is it better then for me to be standing on my feet all day, or should I go sit and stand and sit and stand?
Well, neither is good, because fluid, and this is a little bit of physics for you, but fluid goes into the dependent position. So whether you're sitting or you're standing, that vein blood is going to be pulling down into your legs. So really, walking and elevating, that's what you need to do. I don't know how you can do your work walking, but if there is a way you can sit and put your leg up and do your work, that is what's going to be effective. But there is no difference between standing or sitting, because, again, that fluid is going down towards the earth because of the gravity, either way.
See, I was told that if I stood a lot, like waitresses or people who stand a lot, they get the problems with veins. But that doesn't sound like it's true. It sounds like if you sit all day, you could have it happen also.
Absolutely. There is no difference, because your legs are in a dependent position either way.
You don't know this because you're not in the studio with me, but I usually sit. Sometimes I stand. But after talking with you, there are two chairs, and I have a leg on each chair up.
Well, you're one of those rare patients who listens to their doctor. That's good.
I'll tell you something else that's kind of funny. I know we have a couple more minutes, but about 25 years ago, I happened to find a yoga teacher, and one of the moves that this teacher taught me, is to put my leg up, and I mean high up, and rest it on something, and then the other leg. And for 25 years, I have had, when I brush my teeth or do something, I put a leg high up and hold it there for probably 50 counts. And I never have back problem. I never have leg problem. And maybe something's happened good from that after listening to you.
There you go. Yeah. And allow me to just clarify the elevation. So again, that blood in our legs, that has to find its way back to the heart. So when I say elevating, I mean, you can't just put a stool on the floor and just put your legs there. Your legs have to be elevated. To be effective, they have to be at least at the level of your heart. So that's the elevation right. that I'm talking about.
Yep, that's exactly what I do. I put it up on the sink. And it's amazing now at my age that I can do that, but maybe that's helped. I do still have some spider veins, and I probably should come by to see you anyway, just to meet you and maybe have a little work done. But this is great, and I know we have a lot more to talk about. Maybe we can have you on another time. But you talked about hereditary problems. So when people go into your office, of course, they fill out all these forms about your history, and that would be very important, wouldn't it? If you have a history of any problems with veins, then you're more likely to continue.
Absolutely. I mean, one of the questions in our intake paperwork is family history, because I think more important than venous insufficiency and vein problems is the arterial problems that we need to know about. Because venous problems, they're not dangerous. They're not going to do you significant harm. But arterial issues, the aneurysms, the blockages in the carotid arteries, the blockages in your legs, those are the issues that cause problem and can be fatal. So we need to know the family history. We need to concentrate on those areas that are possibly a disease that is unrecognized in that particular patient.
Well, thank you, Dr. Gashti. We made you famous today, and we made people know who you are, Dr. Gashti. And Dr. Gashti can be reached at his offices. They have one in Deerfield Beach, and they have one in Boca Raton. And you can call 561-483-3989. Thank you so much for sharing all your good information this morning.
It was a pleasure. Thank you.
Yes, thank you. We'll talk to you again, I'm sure, sometime.
Anytime. Thank you. Bye-bye.